What's up everybody, welcome to another Dentistry 101 video. Today we're talking about instruments, specifically the non-cutting ones. By the end of this video, my goal is that you'll be able to name every single one of the instruments shown here, as well as what each one is used for. If you guys really enjoy the topic and content in today's video, then be sure to give it a thumbs up and we can create this into a whole series. Alright, let's get going. Let's get started with a couple easy ones. First up, we have the dental mirror. They can come single-sided or double-sided. The uses are pretty obvious. It helps you to see areas otherwise difficult to see, especially like the maxillary teeth. Also, you'll notice dentists using it to retract soft tissue. So for example, you'll see dentists use it to retract the cheek of the patient so you can see those back molars better, as well as moving their tongue out of the way. So when you're working on a patient and their tongue is flying all around, you can put your mirror and block it. Next up is the Explorer. This is probably the single most used instrument in all of dentistry, even more than a mirror. Some of the uses for an Explorer is to feel for irregularities on the tooth, any sorts of bumps, cracks, fractures along the tooth, any catches in a restoration, and it's also used to determine hardness of tooth structure, aka caries detection, where you just feel a spot that's maybe discolored on the tooth, and if it's a little bit sticky, then maybe it's caries. If it's solid and hard, just staining. Next up, we have the Periodontal Probe, also known as a Perio probe. This instrument is used basically as a ruler. So you can measure the depth of a periodontal pocket around your tooth. You can measure the length of a lesion that you notice on their mouth. You can use it to measure your own instruments that you're using in your hands. It's especially helpful with measuring the length of your burr, so you know how long your burr is, so you know how deep you are cutting into a tooth structure. All right, moving right along. Next up is the Amalgam Carrier. This guy is used to dispense amalgam into the preparation that you have on the tooth. If you don't know what amalgam is, it's just the silver fillings that you see in mouths. This guy is a condenser. The use of a condenser is to compress amalgam. So you place the amalgam in the amalgam carrier and you dispense the amalgam into the tooth preparation, the little hole that you have. It fills it all in, and then you take a condenser and you pack it in tightly to all the corners and edges and everything so that it's filled real tight. Next up are our plastic instruments. You can use these to carry and shape composite restorations before you light cure. Once you light cure something, then it is solid and you are not going to be able to move that without using a burr or something to cut it. Cotton forceps, also known as cotton pliers. The cotton forceps are used to pick up anything. Now, they're cotton forceps because they're more commonly used to hold cotton pellets or cotton swabs or something like that, but really you can use them for anything. But this next one is a little more specific. Articulating paper forceps. And their use is to simply hold articulating paper. Articulating paper looks like this, and it helps you to measure someone's bite. We can cover that in a future video if you're interested. And if you're interested in learning more about it, then make sure that you like the video so that we can make a subsequent video and make this into a series where I can cover other topics, other instruments like this. And I'll see ya in the next one.